Your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency. We are servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. I am delighted to introduce everybody to Dr. Ariel Rodriguez, who's right here actually in Delray Beach. His address is 4600 Linton Boulevard, Delray Beach, Florida, 33445. And you can reach Dr. Rodriguez at 561-829-7982. And the website is sflbariatrics.com. Welcome to the show, Dr. Rodriguez.
Well, thank you for having me, Louise.
Absolutely. I'm excited to learn a little bit more about what you do, and if you want to share with us a little bit about your background. Did you go into becoming a doctor wanting to do this, or what was your original intention? Share with us your journey.
I wanted to be an engineer. But
wow.
My father was an OB-GYN and my mother is a pediatrician, so kind of the medicine blood was running through me.
I see that. Okay.
I got the call, and basically when it became decision time, I wanted to be a surgeon.
Interesting.
I kind of wanted to fix things with my hands. That's where my ultimate calling was, so I took it.
That makes sense, because if you say engineer and then you said, well, let me shift to the medical route, surgery makes perfect sense.
Absolutely.
Right?
I think it did, I think it was a little bit of a rebel phase that I wanted to be something else, but at the end of the day, this is what I love doing.
That's amazing. And where did you go to school?
So I'm originally from Dominican Republic, so I did med school over there.
Nice.
And then I did my training here in the States. I went to California to do my general surgery residency, and ended up in USF in Tampa General doing my fellowship and my subspecialty training in weight loss surgery.
So I'm so intrigued about bariatric surgery and the whole evolution. When did bariatric surgery first come about? Can you give us kind of like the timeline of how it all started?
So it's been around for a long time. Basically started as a partial removal of the stomach for something else, either for cancer or an ulcer when we didn't have the medications for the stomach, and then they realized that patients were losing a lot of weight after this type of procedure. So it became kind of a procedure for weight loss out of those original procedures. And then it has evolved a lot. You used to do a big cut here in the abdomen, where people were open. They spend, weeks in the hospital. Now we do this type of procedures with little tiny incisions in the abdomen, and it has evolved where they used to spend a week in the hospital, maybe then 3 days, and next thing you know, we're sending some of these patients home the same day, where they're, walking and having some drinks and things like that on the same day of their procedure. And even we have procedures that don't involve any surgeries, that we do it all through the mouth, where we just basically, make the stomach really small through the mouth.
So you're actually able to go in through the mouth and do a procedure without opening them up, and you're able to make it a smaller.
Correct. So basically one of the main procedures that we do is called the sleeve gastrectomy, where we go through little incisions and we remove about 75-80% of the stomach. And now we can replicate some of that, not for everybody, but also for some of the patients. We go through the mouth, and with a special instrument, we go in basically close part of the stomach, where when they start eating, if you imagine a balloon, you know, when they start eating, the stomach accommodates all this food, which is one of the problems that we're having right now, right?
Sure.
And all of a sudden, we put all these sutures, and they cannot eat as much. But like anything else, you know, if the only thing they do is surgery, at some point they're gonna fail if they don't change their lifestyle, right? If they're not start making better nutritional decisions, better decisions about their foods, about how they think about it.
Do you work with them on all those components?
Absolutely. We have a full multidisciplinary program. You know, they go through a nutritional education, they go through a psychological evaluation, and, you know, they go through different sessions before they actually get to surgery, which is very important. That's where most of the success happens.
Right, because you want to find the right candidate, I imagine, right?
Absolutely. You know, it's like I said, it's not for everybody. Sometimes they have some roadblocks towards surgery. However, you know, surgery is still the best tool out there for significant weight loss, not just for a little weight loss, right? We have different methods for that. But when we're talking about, you know, over 50 pounds over their ideal weight, then surgery should be a consideration.
So when does this surgery start? In the 70s, in the 80s?
No,
When did they
before
start?
that, even
Really?
even in the 50s, they started doing some things out of Europe, and then you know, that came to the States and has evolved through the years and through the decades. And I think that obviously, you know, the advancement and with technology and things like that have made this a minimally invasive procedure, and that has happened basically over the last 15, 20 years. Even now, you know, some robotic surgery, right, little incisions, very complex surgeries we can do it this way. And like I said, now the kind of the latest of that evolvement is the endoscopic procedure, where we can do it with no incisions outside.
Wow, so they could potentially be doing surgery in the morning, and then a couple of hours later they're done, and then when would they go home? Do they do it in a hospital? Is it an outpatient clinic?
So it all depends on the patient, right? It's not like one for all, right?
Okay,
so we have to
sure.
do an evaluation, and then if they are in optimal condition for outpatient procedure, then it can be done without having to go to the hospital, right? So we do it in a surgery center.
Nice.
And basically we have all the equipment over there just the same as the hospital. The only difference is the process is a little bit faster, and they go home the same day. They usually take about three hours after surgery to, you know, start walking and, you know, be fully awake, and, you know, they make sure that, you know, their symptoms are controlled, that they don't have a lot of pain, that they don't have, you know, nausea or vomiting or anything like that, and they can go home safely.
Who would not be a good candidate for surgery? Like if you had to turn somebody away, what type of person was that? Was it a smoker? Was it what type of
Definitely the
profile?
people that are not ready to do the right changes, right? Yeah, definitely we don't operate on smokers. They have to be willing to give up, and we test it, right? Sometimes they say, oh yeah,
That's
doctor.
good. I was going to
Absolutely,
ask
no,
you.
no. They say, oh
Okay.
yeah, I swear I quit, you know, 4 weeks ago, which is the minimum, and then you test the urine and they're like, no, this says something different. So we have had to cancel some of the surgeries because of that.
Right.
People that have other substance abuse issues, people with some eating disorders that are not well controlled, and people with some medical conditions that will make anesthesia
I see.
high risk or anything like that. We have to control those beforehand. So those are the main ones. Everybody else, you know, we can kind of manage their conditions and make sure they're optimized for surgery.
I think people are wanting to know, does insurance cover this? How does that work?
It's all in the fine print, right?
Oh,
I mean, you know,
yes.
if you call your customer service, they say, oh, everything is great, and yes, everything is covered, but in reality, not a lot of them do. It is covered by insurance, but it all depends on their policy. You know, there are policies that have an exclusion,
Okay.
and there's policies that will cover it under certain conditions, and you know, it's all about getting the right information and you know, going through insurance verification process to make sure that actually it's a cover event, and that the patient is not gonna get stuck with a bill or something like that.
Yeah, it's all in the fine print. Like
It's
you
all in the fine print.
It's all in the fine print. So if, you know, our audience members are listening right now, what would you recommend, like if they're thinking, wow, maybe I should call, I don't know, what would you share with the audience? Like, is there a certain amount of weight that you'd have to be over X amount of pounds, or maybe you can share like who would be a good candidate for anyone listening right now?
I think that the main thing is that, let's say that you keep going to your doctors or through the years and they keep saying, okay, you need to diet and exercise, but here's another pill, or maybe your blood pressure is not under control anymore.
True.
Or all of a sudden, you're pre-diabetic or diabetic, and you have not seen any progress and things are getting worse and worse and worse, then we know that that's not just gonna get better out of the blue. Something needs to change significantly. And it's not like surgery is magic or anything like that. It's not like surgery is the answer for everybody.
Right.
But at some point, that needs to be a conversation. Like, my diabetes is not under control. Am I considering all the options available?
Right.
And sometimes the doctors do not bring this because there's still some stigma out of surgery or around surgery, and this is evolving. But I just think that patients are taking control of their own health right now. And again, if you keep going to a place and they keep telling you the same things and nothing else has changed, maybe maybe it's the time to consider something else.
Yeah, we get to be an advocate for our own health.
Absolutely.
So as an educated consumer or patient, I think it's important that people learn all the different options.
Absolutely.
And like you said, it's not it's not one and done. You have to do the maintenance.
Correct.
And you have to make sure that you're doing the proper eating, the proper diet, and the maintenance, because I have heard of some people that have done a surgery and then they've gained, a couple of years later, they have gained the weight back.
Yeah, absolutely.
How does that happen? People want to know.
Well, like the main thing that I tell them is there's certain things that there's no surgery there's no surgery for sweets, there's no surgery for ice cream, let's say.
Right.
Because there are a lot of empty calories that doesn't matter how small the stomach is, they're gonna go through. So you're gonna, the whole idea about surgery is that once you start, because surgery will accelerate the weight loss process, so you see the results a little bit faster, and the whole point is that to get that motivation and start creating new habits, right? And if you fill that small stomach with high quality proteins and things that are kind of difficult to digest, not these pre-digested processed foods, then your body will respond accordingly. And then the ones that stick to it and do some exercise, they have to increase their muscle mass. That's very important, especially for probably our audience. Every year that goes by, you lose a little bit of muscle mass. So there's no way to maintain a healthy weight without increasing your muscle mass. So that's very, very important. So those changes are necessary in order to obtain long-term success. So the people that struggle with that or go back to their old habits are the ones that usually regain some weight.
How important is it, Dr. Rodriguez, how important is it for them to have a support system at home?
It's again, without support, there's just no long-term success, because life still happens after surgery. So something can happen in your life that sets you back, and if you don't have the people to hold on to, or the people that can take you through these events, you can certainly get a significant setback. And that's one of the things that I think that characterize me and my partner and our team, where we're pretty much available to our patients all the time. They have our cell phone numbers, they text us in the middle of the night when they have a question or a problem. And I think that because it is very important to have, or to feel that you have the support of the team that you're working with. And we're very proud of that, and I think that it makes a big difference. Even patients 5-10 years down the road,
We have a quick commercial break. We'll be right back.
All right.
Stay tuned, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. We are enjoying this conversation so much with Dr. Ariel Rodriguez. You can reach him at 561-829-7982. He's right here at 4600 Linton Boulevard, Delray Beach, Florida, 33445. And the website is www.sflbariatrics.com. So, Dr. Rodriguez, you have a practice with another partner, is that right?
Correct. Dr. Ciesa is my partner. He's from Peru, and we've been in the community a couple years together.
I like that. That's great to know that, if I needed to speak to you or maybe you're not available, at least I know that
Absolutely.
You have somebody to cover you. So that's always
Correct. It's nice to have that type of support for myself and for my patients as well.
Absolutely. Yeah, because I like how you said you give your cell phone number out. So if for whatever reason your patient has a question, you're not there, they can at least connect with someone else. So that's
Correct.
really good to know.
They always know who to call and who to reach. So
That's good.
yeah.
So let's dive a little deeper into the different types of surgery. So you mentioned, I heard you say something sleeve.
Correct.
Can you give us a little more detail about those?
Correct. There's
surgery?
different type of procedures, and it all depends again on the sit down with the patient and having that conversation about their particulars and the medical history and things like that. The sleeve gastrectomy is one of the most commonly performed procedures, where we basically divide the stomach and make it really small. The gastric bypass is one of the older procedures where not only we make the stomach very small, but we connect it directly to the intestines, and that kind of bypasses part of the stomach, and is very metabolically active. It's specifically for patients with like diabetes or bad reflux. Is probably the indicated procedure. And like I said, we have a newer procedure, which is the endoscopic procedure, where we basically just placate or put together the walls of the stomach so it cannot expand. And there are other procedures that are a little bit more extensive than others, or they're more simple. And some patients come asking for a specific procedure, but what I tell them is come with an open mind so we can have an honest conversation of what the best option for each specific patient is.
Right, because if you have somebody with diabetes or a different health ailment,
Correct.
You may want to prescribe a different type of surgery.
Absolutely. Very important that we have, again, a detailed conversation about the medical history, about their goals, about what are they trying to achieve, or what are their fears about surgery, so we can tailor our approach to them.
So I have a question, Dr. Rodriguez. How soon what does the weight loss journey now look like? So I had the surgery. Give me for instance, all right, I go back home. What am I eating? How long is this whole journey going to take? What are you going to share with us?
So everybody is different, but I like to talk about average, right?
Okay.
So for most patients that we operate on, let's say they're gonna lose somewhere between 20 to 30 pounds in the first few months, and then what we want, patients want this kind of weight loss, lose it all in the first few months, but that's not sustainable, right? Because then will come a big rebound, right? Because the body doesn't have the time to adapt. So what we want is somewhere between 1 pound to 1.5 pounds weight loss per week, which is about 4 to 6. So it takes a lot, a few months. At the beginning it's faster, then it's slower, then the patients are calling, oh doctor, I'm not losing any weight, but we look at their metrics and they're improving. So they need to have some patience, right? It takes some time to gain the weight, and it's gonna take some time to lose the weight.
This is true. You didn't gain it overnight. You're not
Correct.
going to lose it overnight, right?
Exactly. So it's very difficult when everybody is expecting some instant gratification or instant results. It's like, it's not magic. We still have to go through the process and let the body kind of, get rid of all the toxins, get rid of the excess weight, get rid of the excess fatty tissue. So it takes time.
Yeah. So how does the body get rid of toxins? Are they doing just by changing their diet? They're getting rid of toxins?
Yeah, absolutely. So the main thing is like once you stop eating the toxins and eating all these processed foods and the chemicals and the preservatives and things like that, so it allows your body to heal itself. So by stopping the intake of all these products, then your body starts healing itself, getting rid of all these things and changing its metabolism slowly. And then, once you start being on a calorie deficit for a while, then start eating into its reserve, which is mostly fatty tissues, and your liver then start clearing all the toxins from your body and start excreting them. So the body's an amazing machine.
Isn't it amazing?
But we're doing really bad things to it right now, specifically with our diet.
Well, you had a key word that you said. I really liked it. You said we have to stop eating these products.
Absolutely.
They're not food. It's a product.
Exactly right.
Right?
Exactly right.
It's a product. They're
Totally.
selling it because these companies are very smart. They know all these types of ingredients that really get us addicted.
They know you better than you know yourself,
Yeah.
right? They know what's gonna hit. They know what's gonna keep bringing you back to the same products. They have engineers that their only
Yes.
job is just making sure that you keep buying their products.
That's
so
right.
It's not a fair battle. Some people want to go at it alone, but it's just your winning chances are very, very low when you don't get educated and you at some point stop the behavior that they want to encourage.
Yeah, this is true. And I've heard that a lot of these old tobacco companies, R.J. Reynolds, all these ones, they're the ones who bought a lot of these companies.
They have. It's again, they know how your body works. They know what it likes. They know how to trick your taste buds. They know how to
Right.
trick your dopamine centers.
Yeah.
So it's
hijacked.
Yeah, it is hijacked.
It's
Absolutely, it's
hijacked.
hijacked. And then again, they start with the little children, so it's very difficult behavior to break once you have grown into this for all your life.
This is true. Yeah, we got to start them young, eating healthy
Absolutely.
and eating fresh foods.
And it feels like an impossible battle, especially when there's cake and sweets everywhere.
Right.
They're so available, so
Yeah.
cheap, and but at some point we need to grow conscious that this is not correct. This is not healthy, and there's no nutrition in these things, and it's just killing our body slowly. You don't feel it.
Right.
But it's not going in the right direction.
Absolutely. So as a person begins their journey back to eating food, I knew somebody who had this surgery years ago in Europe. She had to eat very slowly.
Absolutely.
She was eating very slowly. And actually, we have like 1 minute left. So I didn't realize how fast this is going. Oh, we have 3 minutes left. So we have a couple more minutes. But I know she had to eat very slowly. So what does that transition look like for a person?
So after surgery, you need to allow the stomach to heal from the inside, right? So
Right.
we first start with liquids for a while, about 2 weeks, and then with soft foods, allow all the inflammation of the stomach to reside, and then it takes about 3 months to go back to our normal diet. And yes, we have to relearn how to eat. The pace of living right now, people are eating on the go.
Right.
They don't have time. They're rushing. They're going through their cell phone. They're not paying attention to what they're putting in their mouth. So we need to change that behavior. And eat slowly. Enjoy what you're eating. Now with a smaller stomach, you have to enjoy it a little bit faster. Just be mindful of what you're doing in the moment, which is.
I love that.
Yeah, it's hard to do, but the more practice you get, then it becomes second nature.
So as a Hispanic person, asking another Hispanic person, how important is it for us in the Hispanic culture to have that family meal and like to really create that like, oh my God, I missed that. I'm like thinking about, I'm getting nostalgic. Like, how important is that to incorporate into our day?
We know that that's one of the main factors contributing into happiness, having that community. We have lost all that because of the pace of living, because everybody's working at the same time. Everybody's doing their own thing. Everybody's on their phone. It would be nice to go back to our roots.
Yeah.
And sit down, talk, discuss, and enjoy a meal together, a healthy meal together.
A healthy meal. Yeah, I like that. I think it's important for us to be present and to really, go back to the basics, cook a healthy meal and share it with the family.
And take care of the family, absolutely.
Yeah. So we have like a minute and a half left. Anything you want to share with the audience, please do.
We're very available for questions. So if anybody has any questions, please reach out. We go, social media, our emails, our website. So
what's your social media? Do you have an Instagram?
Is Dr. Dr. Ariel Rodriguez.
Okay.
Ariel Rodriguez, and people write to me all the time. I have conversations with them, and I answer any questions that I can that way.
Oh, I like that. That's good, because people may be like wanting to do it, afraid to call, but social media is good because then they can kind of.
Let's reach out, informal conversation. Obviously, there's limit of what we can do through that, but at the same time, if it's the right time and the right moment, then we'll be available.
I like that. Well, I'm going to give your information out one last time. Dr. Ariel Rodriguez, you can reach him at 561-829-7982, right here at 4600 Linton Boulevard, Delray Beach, Florida, 33445. And the website is www.sflbariatrics.com. Thank you so much. It was so delightful to have you on the show.
Thank you, Louise. My pleasure.
I appreciate you.
Thank you.
We'll see you next week, everybody.
Have
a great night.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored